plans to reinstate the indoor mask mandate? Lifespan doctors are coming out in an hour to back that coming back.
Yeah, so we're open to it. As I've stated yesterday, everything's on the table, whether it's masking or whatever it is. Right now, we're not ready to do that. We're certainly relying on the people of the state of Rhode Island, as they have with the vaccination rate, to personally make the right decisions for them in terms of their safety, and we're encouraging them to do that.
Hello. Governor, you said earlier that you're preparing executive orders to comply with the requests of the hospitals next week. What are they requesting, and what are the orders going to entail?
Yeah, so we're exploring, I can tell you one of them, which is because they're, as I mentioned before, when we compare, the hospital demand that's there and compare it to a year over, they recognize that they got a staffing issue. We recognize from where we sit that we got to continue to manage the COVID infection rates, which are significantly lower than they were last year at this time. So 226 people in a hospital today, and we had close to 500 in the same date last year. In many ways, they were able to manage the 500 better than the 226. So it's not a COVID issue. So one of the ideas, I'll just tell you, the other one we're exploring is just making sure as people are transported to hospitals, that there's a system that would bring the individuals to hospitals that can best manage it at that moment in time. So that's one of the things that we're talking to them on, and it seems as though that's one of their asks. So we're going to try to accommodate their asks in relationship to the operations. Yeah, the other one has to do with, and we're not ready to say that's going to happen or not, but the indemnification issues that were in place a few months back. What I've been explained is that because of the stress and the staffing, that there's a certain amount of they feel there's a certain amount of coverage that they would need to keep the staff feeling comfortable about performing their duties.
I'm going to go Alexa, Brian, then Kathy.
Governor, is the Department of Health advising you to mandate masks indoors?
They're making certain recommendations, and we're listening to all the recommendations. I wouldn't say that they've made a recommendation, but we're in conversations on that issue, on indoor masking, and where it would be. We're in discussions about where that could possibly be, and in fact there was a need to do that. We're following the issue, whether it's in a large venue or not. So those discussions are not completed yet, and we're comparing certainly notes from everywhere in the country, in particular along our stretch. Right now there's 6 states in the country that have a indoor mask mandate, and those mask mandates were in long before the new variant. And each one of those states were doing better in terms of infection rates and death rates, in terms of vaccination rates. So we're weighing all the options, and we're at it 24 hours a day. I expect to be at it this weekend as well, in terms of meeting and discussing and making sure that the timeliness of our decisions is in the best interest of the people in the state of Rhode Island.
So what are the benchmarks to instill that mask mandate again? I mean, is there a certain number of cases, hospitalizations per week? What is it?
Right now, I think it's because of to recognize that that what's driving the concern is staffing, not the infection rates. When we were handling infection rates that were significantly more last year at this time than we are today. So I think we need to take a very objective point of view and listen the fact that right now the hospitals have it's a staffing problem as opposed to an ability to manage the current conditions. So we got to keep a track of the current conditions in terms of the infection rates, death rates, and as well as the demand on the hospital. So we're taking all that into consideration as we make up our decision about what to do. But right now, that's why we're saying get your booster. Make sure if you're unvaccinated, we're recommending strongly that you're wearing a mask. If you're eligible for your booster and you have the booster, we're recommending you wear a mask, and that's where we are at the moment. And as things change, we'll keep everybody notified as as we make, if there are any additional, changes in that
We're gonna go Brian,
strategy.
Kathy, then James.
Can I just ask one more follow-up question?
Sure, go ahead.
Alexa, you get two.
Okay, just one
This is
more.
the last one.
Yes. You need a microphone.
Thanks. Every single leader at every hospital system in the state has told the Boston Globe that they are for an indoor mask mandate. If the Department of Health is also, recommending it, so what is it going to take to get there?
Yeah, so the discussion is still ongoing. It's not a closed discussion, I said. All issues are currently on the table, and we're going to do what we believe is in the best interest of the state of Rhode Island, and we're taking everybody's opinion into consideration.
Right over here.
Governor, what is your reluctance to bring it back, the indoor mask mandate? If the medical professionals are now going public that they believe it should happen, what is your reluctance to do it?
Well, I think you need to continue to see where we are as a state, and let's see how people respond. They responded very well without mandates in terms of the vaccinations. Again, many people here that were listening to me saying we're going to get to 90% back in March or April were somewhat in disbelief. So we've managed this thing very well. During the Delta, we were receiving some of the same urgings, but we were able to, work our way through the Delta because of the vaccination rates, because of the behavior and the decisions that the people in the state have made. That we had the lowest, on average, the lowest death rate, the lowest infection rates in the country during the Delta timeframe. This now we're faced with going indoors. It's a new, it's new information. We're looking at it, and we're going to make the best decisions that we can based on the advice that we get.
If you wait till after the holidays, is it going to be too late?
So you don't know, and no one said that you wait until after the holidays, but I can tell you that I did talk to the governor of Connecticut today, and he's managing as we are, and and our infection rates are a little lower than his is. Some of the metrics we're actually a little bit better, not much. We're very happy that Connecticut and Massachusetts have done what they've done regionally, because that adds to our ability to manage the situation. But yeah, just like us, PPAC is masking up. His art and music venues are masking up. Any business out there right now that wants to do that, they're free to make their moves that way. And we're just going to keep a close eye on the whole issue, and then we're going to do what's in the best interest of the people of the state of Rhode Island.
Governor, asking you to elaborate, please, on what you said earlier. First of all, the hospitals have asked you to issue executive order. Do you have anything in writing from them you can share as to what they have asked you to do, number one? Number two, you mentioned two things that somehow you're going to put in an executive order. One is indemnification. What do you mean by that? Do you mean giving them immunity from lawsuits if anything happens that is not a result of direct negligence, which was much earlier in the pandemic? And finally, number three, and I can run through them again.
Good, I hope I got 1, 2. I think I got 1, 2 down.
You got one more, one more, which is the first one you mentioned. And how do you, through an executive order, tell ambulance drivers and people driving their relatives to a hospital which hospital to take them to?
Yeah, so I mean, again, it was you asked a question, I gave you the update. I mean, a lot of those details have to be worked out in terms of, what methods you would use to do each one of those things. Again, I haven't seen anything in writing, so it's difficult to say, I'm on board with that. I'm just sharing that we're in conversations with the hospital leadership, and they have made certain recommendations that we're exploring. So yes, you're right. You don't know whether the transport would be done through some sort of a policy or some sort of an executive order. That was a request. We're looking at that right now. There's nothing in writing, Kathy, so we are, after a call that I had earlier this week, we have our staff talking to their staff to kind of determine what makes sense and what doesn't make sense.
And about the indemnification, is that immunity from civil lawsuits except when there's gross negligence?
Yeah, so I mean, again, I haven't seen the exact language that we would determine. We're having our legal department take a look at what that would mean, and I don't want to speculate on questions, especially legal questions, so I'm not an attorney. So I will make that very clear about, if in fact something happens there earlier in the week. We expect that we're trying to accommodate the hospitals on those requests.
Do you know when it lapsed? 'Cause
I'm not remember when that lapsed. We were certainly trying to clear the deck of a lot of executive orders. We had 6 pages of them, I think, when I showed up. We got down to like a half a page, and we'll respond. We'll use the authority of our office where we think it makes sense.
So we're going to go James, Michael, Richard, and then Laura.
Hi, Governor McKee. James Bissett from the Providence Business News. You've heard, obviously, the concerns from the hospitals, but have you heard any concerns from the small business community from the state? Because I spoke with a couple of leaders from both the Small Business Coalition and also the Rhode Island Hospitality Association. They're very concerned about, for a myriad of reasons, if there is a indoor mask mandate that would be imposed. So have you heard any such concerns from the small business community during your discussions with the various parties involved? And if there is an indoor mask mandate, what sort of support would the state be offering the small business community to kind of help through whatever impacts that they may incur?
Yeah, so the question is, I'm getting a lot of advice from a lot of different directions. Some are more extreme than others from both the right and the left, and then we're trying to figure out how to do the best, to make the safety issue is a critical one. As I expressed before, the main concern I have is what I've been told about the staffing levels in our hospitals. So I've been told that at least, and I'll let the hospitals speak for themselves, but we're not talking about several hundred, we're talking about several thousand employees that are not in the hospital setting that had been in the setting just 2 years ago. So all considerations are on the table, but the main, the decision making that we make will be based on how we can manage. I can tell you the most critical issue that I see right now is the capacity of our hospitals, our healthcare system, to answer a significantly less infection rate than last year. I mean, it's close to, I think we're 2 times less in the last data I saw in the infection rates as last year. I think that we're 7 times less on a daily count in terms of our death rate, and we're 3 times less on the infection rate. So that's the last I've seen. It may have changed. It may be different than what I saw maybe 48 hours ago, but that's what I've seen. So we're taking everything into consideration, as we have in working with the Delta, as we had when we opened up our economy earlier than what was projected. And the state of Rhode Island is a leader in the country, and we intend to keep that standing, and we're going to make sure that the health and the safety of the people that live in the state of Rhode Island is the top priority. That's why I encourage everybody to get your booster shot, get vaccinated, wear your mask if you're not vaccinated, wear a mask if you have entitled to a booster shot in timely way, get your booster shot. If you're not, then you wear a mask. And we'll use everything that we can to also maintain that we're #1 in the country on our economic recovery. I think that they're both hand in hand, but the top priority is the safety of the people who live in the state of Rhode Island.
With respect to that, you said that use everything that you can. Would that be some additional ARPA funding to be helping out, not just the hospitals, but with everybody involved? Because if this is a indoor mask mandate, it's the entire state.
Yeah,
so what's going to be?
So I won't get, again, it is a hour-to-hour situation, day-to-day situation. So I'm not going to get ahead of if we go down a road that we're not going down right now, and then it has implications, then we'll address it at that time. But I'm not going to speculate about where that is and what problems that's going to bring. We'll deal with that at the moment that we have to deal with that. Just like we have with reopening the economy significantly earlier than we had projected when I became a governor, and dealing with the Delta the way we have. Don't underestimate the way that we dealt with the Delta. That was we were hearing the same things at that moment in time about the potential urgency of that. But we looked at all the data. We made decisions on an hourly, 24-hour basis. We're going to continue to do that and protect the people in the state of Rhode Island. That's the plan.
Okay, we go Michael, Richard, Laura, Pat, and then we'll see where we are with time after that. Governor, how would you respond to some of the criticisms directed on the decision by the state to enter into collective bargaining agreements to compensate state employees for $3,000 each to be fully vaccinated?
Question in terms of the stipend, I think it was a misstep, and I think I've started to correct that. The coalition that is, you know, that voted on the other part of the union, I think it's about 2,400 members. I let it be known that I thought it was a misstep. The connecting in was overshadowing the purpose of settling an agreement that was 18 months overdue, should have been settled before I became governor. And it was overshadowing the real purpose, in my mind, of a stipend, which was to you know, make sure that we manage the situation, get a good agreement for the people in the state of Rhode Island, and I consider it a misstep. So what was voted on today, I'm told, by the coalition, and I can speak publicly about it, is that there is a stipend, but it's not connected to the vaccine. And I have talked to Local 94 today, offering them the same opportunity of choose. We'll keep our promise to, you know, and our commitment on the contract, but we're open to reevaluating that. So yes, I think it was a misstep. I think we've corrected it, and I've listened to people, and that's why I stepped in and did what I did.
Are you open to the General Assembly proposal that's been mooted to prevent that from happening again?
Well, connecting into a vaccine, again, I'm not going to politicize that issue. All I can tell you is that I think it was a misstep. We corrected it. You know, we're going to make sure that we do right by the taxpayers in terms of an agreement, which I believe we have. And I want the focus to be on that. I mean, we've spent a good part of this session talking about labor shortages. That's no different in our, you know, in our state workers as it is in the hospital, as it is in the bus drivers or in the hospitality. So the stipend in terms of like a retention strategy that was in there was perfectly, you know, it was well done. I don't want to take away from the negotiations. I think that piece of the negotiation was taken away from the value that was brought to the table there, and so I stepped in and corrected it.
Yeah. One of the big issues that was developed from the testimony at a Senate commission hearing last week was about the failure to raise Medicaid rates for more than a decade. And it's had a dramatic impact across the board on whether it be early intervention or behavioral health or housing issues across the board when you talk about staffing. And there's been a failure to raise those rates, and the legislature is preparing, I think, some action to take. What is the role that you can take as governor to change the way that Medicaid rates are being set and stop them from being so artificially low that businesses, small businesses and agencies can no longer deliver the services and have to go out of business?
Yeah, so again, I'm not an expert in that field. If there is an unlevel playing field, which I think there is, we need to address it. We have done that in several ways. But I also would say that we're going to find in terms of the employment, the problem there, in my estimation, and I'm going to bring people to meetings next week to actually get into a more serious conversation about staffing issues right now, right? It could be the dollars. It's probably not the dollars, although I'm not saying you shouldn't level the playing field on what the compensation is. But I think that people are going to be very sadly, just like they were, a lot of people said, to get off the unemployment benefit, and we're going to have workers in the field, right? It's been 90 days. We don't have workers in the field. And there's a heavy push in terms of hourly rates, both in the union side and the non-union side. I think this is an opportunity, and that's one of them, is to really look at where the unlevel playing fields are, and then also to deal with that if you can, inside the budget. So we plan to do that. We did that with the COLA last year with in terms of the nursing homes. We intend to take a look at it, see what you can do, and then try to level as many playing fields as we can.
One more budget question. I have heard that there was a recommendation put before the health department as an initial budget discussion to cut their budget by 25% by COVID-related matters. Is that not true? Can you say that that's not true?
We're going to make sure that we have the funds to make sure that we take care of the COVID situation. So I would say that's characterized as not true. But I can tell you on the budget issue, and I'll share where I am on the budget issue, we want to make sure, you know, we grew to a $13.1 billion budget, and a lot of that stress was what we were told that is COVID related. So I have instructed us to get back to where it makes sense, back to pre-COVID budgeting, and then do some sort of cost of living increase there so that we settle in on a real non-COVID budget that we would be presenting to the state of Rhode Island. So I don't know what you're hearing there. All I know is that we're having at least 2 hours of budget sessions with me and them daily, going department by department. We'll have the money to deal with the COVID issues, and that's a priority because we have made that a priority in terms of the health of the people in the state of Rhode Island.
Governor, two legislators in Newport wrote an op-ed asking the General Assembly to override your veto of a short-term rental bill. So, three-part question. Why did you override or veto the bill in July? Do you stand by that veto? And what's your reaction to their call to override it?
Yeah, so I expected that, and I think that I know the local community sees a value in that. It's not that I don't see a value in, oversight in the way from the state level. There were some conditions that the Department of Business Administration put down that felt as though that they, felt as though that legislation could be adjusted in a way. We never got the opportunity to do that. We never, I never saw it until it came to me, and we had, individuals and including some municipal leaders that, asked me to, to hold off on that. But happy to meet with the senators and work out a strategy that would move forward and address the issue that they're trying to address. I applaud their leadership. It's not something that I wouldn't want to talk to them and get in a position where you might revise it slightly or a little bit to kind of answer some of the questions that were on the table that the Department of Business Regulation put in.
Why did you veto it in July? And do you stand by it, your veto?
No, I answered the question. I in principle, I like the idea, and that I would like the opportunity to, work with the senators in terms of addressing some of the concerns that the Department of Business, Regulation had on that particular bill. Yep.
Sure. Governor, by now we're all aware of the supply chain issues that have placed immense burdens on consumers and the business community. Complicating that is the inflationary spiral touched off by massive government spending. Currently, the state of Rhode Island is projecting a budget surplus in excess of $600 million. Finally, Congressman Cicilline has projected over $1.7 billion in federal highway aid and bridge replacement to Rhode Island. With anticipated toll revenues of $40 million in 2022, ripped right out of the pockets of consumers and an overburdened truck industry, is it time to end truck tolls in Rhode Island?
No, and we're going to keep the Roadworks program going because it's very important to the economy of the state of Rhode Island. And I wouldn't, the way that you characterize that, quite frankly, I like surpluses. I don't like deficits, either in business or in government. So when I budget for a break even, and I manage for surplus, and then we can take those dollars and invest those dollars in things that, quite frankly, I've inherited a lot of loose ends, and from Eleanor Slater all the way down. So we're going to manage to try to create as much as we can by controlling the budget. I just answered that, just offered that up of how I'm approaching this year's budget. But the infrastructure is an important ingredient to our state's economy. And it is working, and Director Alviti has a good 10-year plan, and if the federal government wants to send our money back to our state of Rhode Island, remember, that's our money, we send it to Washington, they send it back to us, we're going to use it, and if we can compress the 10-year plan into 6 years, we're going to do that so that we can kind of continue to position the state of Rhode Island in a real strong way, as we are right now. Number one in the country and returning to our economy. A big part of our factors in terms of our rankings, in terms of small business friendliness in our economy, is based on our infrastructure. And we're going to do everything we can to make sure that the state of Rhode Island has a great economy, and that is helping us get there with the Roadworks program.
Governor, and follow up, a big part of that ranking in terms of number one recovery is the fact that our economy was quite poor to begin with. Isn't returning taxpayer dollars to taxpayers, which is their money, a better plan for an investment as opposed to this continued bloated bureaucracy?
We're going to manage the state of Rhode Island to make sure that the economy is strong, people are safe in this environment, and our schools are opening so the kids are in the classroom. That's how we're going to do it, and we're going to be fair to the taxpayers in the state of Rhode Island. At the same time, we have objectives that we have to reach to, you know, achieve those goals. So we're gonna do the best we can every day.